Okay, hello and welcome. Look, we all know dealing with the baby's nappy rash, it can be so stressful for any parent or caregiver, right? But don't worry, you're in exactly the right place. In this explainer, we're going to break down exactly what's going on and, most importantly, how you can help your little one feel better and fast. Yeah, seeing that angry red rash on your baby's delicate skin, it's just plain upsetting. But here's the first thing I want you to know. You are absolutely 100% not alone. Nappy rash is so common. And the best part? It's totally treatable. So let's dive in and figure this out together. Right. First things first, let's get on the same page. What exactly are we talking about when we say nappy rash? Okay, so the fancy medical term is diaper dermatitis, but really it's just an irritating skin rash that shows up anywhere a nappy touches. We're talking the genitals, the bottom, the groin, and sometimes even up onto the thighs. It's basically a direct reaction to what's happening in that little environment inside the nappy. So what does it look like? Well, you're going to see red, maybe even spotty skin. Sometimes it can look a little moist or kind of weepy. And of course, you'll probably notice your baby is just not happy about it. They might be way fussier, especially during nappy changes. And that makes sense, right? You've got irritated skin and then urine comes into contact with it. Ouch. So, just how common is this? Get this. An estimated 50% of babies will get nappy rash at some point. That's 1 in every 2 babies. I mean, think about that. This number is so important because it proves this isn't about you doing something wrong. It is a totally normal, if annoying, part of having a baby. Okay, so if it's so common, what's actually causing it? Getting to the bottom of the why is the key. Not just for treating it now, but for stopping it from coming back again and again. The main villain here, by a long shot, is just dampness. Think about it. When urine and poo hang out together in a nappy for a while, a little chemical reaction happens. Bacteria starts to create ammonia, and that ammonia is what really irritates the skin. It basically messes with the skin's natural protective shield, and boom, you've got that red, angry rash. And you know what else loves that warm, damp environment? Yeast. Yep, a specific kind of fungus called Candida, you might have heard of it as thrush, it thinks a wet nappy is the best place to party. This can cause a secondary infection right on top of the first rash, making everything way worse and, well, needing a different kind of treatment to knock it out. But wait, there's more. There are a bunch of other things that can make a bad situation even worse. For instance, if your baby already has sensitive skin or a tendency for something like eczema, they're just going to be more prone to it. Other culprits? Things like rough nappies causing friction, maybe some detergent that didn't quite rinse out of cloth nappies, even those old school plastic pants that just trap all the moisture in. Oh, and going overboard with soap can strip the skin of its good oils. And yeah, the big one, teething. So many parents swear that nappy rash gets worse when a new tooth is coming in. Okay, can we just pause for a second? Because this next point is maybe the most important one in this entire explainer. Seeing a nappy rash does not, I repeat, does not mean you've been neglectful. It doesn't mean you're a bad parent. As we just talked about, some babies just have more sensitive skin, and this isn't a ridiculously common problem. Please let go of any guilt you might be feeling. Okay, so we know what it is and why it happens. Now for the good part, how to fix it. Let's get into your clear, simple, at-home action plan. Honestly, your whole game plan can be summed up in one easy mantra. Ready? Keep it clean, keep it dry, and let it breathe. That's it. If you just focus on those 3 things, I promise you are already halfway to healing that sore little bottom. So what does that actually look like day to day? Well, step 1, change those nappies often, like as soon as you know they're wet or dirty. Step 2, when you clean, be super gentle. You don't need fancy wipes. Plain old warm water is perfect. Step 3, and this one is crucial, pat the area dry. Do not rub. Rubbing is the enemy of irritated skin. And finally, step 4, nappy free time. As much as you can manage, let that skin get some fresh air. It works wonders. Let's make this super simple. Here are the do's and don'ts. You're going to want to pat the skin dry, not rub it. You're going to use warm water and avoid soap, which can be way too harsh. Let them have some nappy-free airtime, and definitely skip those plastic pants. And last one, use a good protective cream, but please avoid baby powder. It doesn't really protect the skin and can actually be a risk if your baby breathes it in. Okay, but what if you're doing all the right things and it's just not getting better? That's when medicated creams can be a real game changer. So let's talk about the different types and what they actually do. You'll find pretty much three main kinds of creams out there. First up, you've got your protective barriers. These are things with zinc oxide or lanolin or even just Vaseline. They literally create a physical barrier to keep wetness away from the skin. Then you've got antifungal creams. You can usually buy these without a prescription, and they're designed to fight that yeast infection, that thrush we talked about. And finally, number three is a mild cortisone cream. This one's usually prescribed by a doctor, and its job is just to calm down all that inflammation and redness. Now, for those really stubborn or nasty rashes, it's super common for a doctor to prescribe a kind of combo cream. They'll actually mix an antifungal and a mild cortisone together. It's smart, right? It tackles both the infection and the inflammation at the very same time, which usually means much faster relief for your little one. Now, this is a really important rule of thumb. If you've been trying all this at-home care for, say, 4 days, and that rash just isn't getting any better, or worse, it's spreading, it is time to call the doctor. Seriously, don't wait. Just make the appointment. All right, so you've cleared up the rash. High five. But now the question is, how do you stop it from ever coming back? Let's talk prevention. Really, this prevention checklist is just about making all those good habits part of your daily routine. So keep that skin dry with frequent changes, give them a little bit of airtime every single day, slap on some of that protective barrier cream, skip the soap and baby powder. Also, try not to bathe them too often. Believe it or not, once or twice a week is plenty to avoid drying out their skin. And if you're a cloth nappy family, just make sure they get a really good rinse. This is basically your blueprint for a happy, rash-free baby. So as we finish up here, I want you to think about this. What's just one small thing you can change in your routine starting today? Maybe it's just giving your baby an extra 5 minutes of nappy-free time after a change. Or maybe it's just deciding to use plain, warm water instead of wipes for a few days. Just remember, you don't have to do everything at once. Even one tiny change can make a huge difference for your little one's comfort. You've got this.